So once the patient has come through the main door, we receive the patient here, and also we have the boundary here. So we have the preparation. We give the patient the gown and the caps at this side, so that we can proceed. We proceed to take the patient to the bed. They are still at the recovery room. So here we do the preparation of the patient, the counseling. Also have to check the patient's file and also to review if the consent have been sent. So we also view the results of the patient here again. We also have to prepare the patient, like we have to give the patient the name tag. We have to see if the patient has been catheterized, if the patient's dentures have been removed. So everything is done here. So we also have the counseling team that also do here. We counsel the patient for at least like 10 minutes because to calm them down, psychological support. We also take the vitals. Patients' vitals are taken at this side. So the receiving vitals, you receive the patients with the vitals. So it's done here. And then from here, now we proceed to the operating room. So we go through here to the operating room. Here we found with the patient. So the operating table already should be made. So the patient is taken to the operating table. So in the operating room here, we have the fridge. For the fridge, it's used to store some emergency drugs that are used here. We also have the kind of oxytocins because of maybe the patient is undergoing the CS section. So we'll have to store the oxytocin in the fridge. With us here, we have the trolleys. The trolleys are used in the preparation of the patient, the preparation of the equipment, everything. They'll have to be set here. For us here, we have the resuscitator. So if the baby has been delivered through the CS, we have the resuscitator so that it can keep the child warm. And also the first aid can be done here, where when the child, let's say the score is poor or requires cannulation, everything, assessment of the newborn also done here. For us here, we have oxygen cylinders. So the oxygen cylinders majorly it's for the anesthetic machine because some patients come, they can undergo the general anesthesia, so they'll need the support of the oxygen. So this is the section of anesthesis, the anesthetic machine. This one is used so when the patient is under general and the spinal, so the monitor is here to monitor the patient's vitals. This is the for anesthesia. So here we have a trolley. This one, we also have some drugs that are stored here. The sutures are stored here, the blades, and we also have some of the equipment that are used during the procedure. For us here, we have the diathermy machine. So this one is used during the procedures when we don't want to use maybe the blades. We use the diathermy machine, or we just use it to open the skin. It's a very nice machine. For us here, we have our lights. This one, mostly we use them so that we can have the clear visibility of what you are doing. When you have opened the abdomen or wherever the part of the body you have opened, we have our machines with us here. These are the lights and they are movable. So we'll have one of the operating, the circulating nurse or the nurse who will be circulating, so that they will be controlling these machines for the operating team to have a clear view. Same to this machine. For us, it's an operating table. So this is now where our patient will have the procedures being done. When you come to this side, we have our sanction machine. So when you have, let's say, a cesarean section, maybe the liquor, when you have opened the uterus, we have this on the sanction machine. So we use it so that at least we shall not have a dirty field, operating field. This one is a stool, a guide stool, so that maybe when we are doing the cervical repair, so it's movable. The gynecologist easily will have the comfort of assessing the area clearly. So it's used for mostly the cervical tear repair. So when we Once the patient has been operated here, everything is well, the patient is stable, vitals. So we have to take the patient to the recovery room for observation for 1 hour. And the patient is stable. Now it's when you can transfer the patient to the wards. So once we are done with operating room, we have our sluice room. We have our sluice room. So inside the sluice room, those gowns or the drapes that were used during the procedures, you calm them, we sluice them, we soak them. We have the antiseptic that we use to clean them. Once we have cleaned them, we have a hang line. There's a hang line at this end. Through this door, we hang them there so that the CSSD nurse can easily take them from that side there. So with us here, when you go through this door, we have our hand washing center. This is our hand washing center. So for this side, this is where the operating team scrub the surgeon, the assistant surgeon, the scrub nurse. Here is where they scrub before they are going to the operating room. For this side, we have our store. Here is our changing room. So this is where the operating team change before they go inside the operating room. When you come to this side, we have our store. So for our store, we have the fridge. This one is just to store the blood. So when the patient in case bleeds inside the operating room, so we have our blood ready here with us. These ones are the instruments that are used during the procedures of these. So depends with the procedures that you want to do. So we know how we mark our instruments. All the procedures, all the instruments are here. All these are consumable that we use during the procedures. So this is just the store. When you come to this side you have our CSSD. So this is where sterilization takes place. So this is our sterilizing machine. We have the CSSD nurse. When he or she has sterilized the instruments, so it's when she can now deliver the instruments to a respective area. Okay, so from this end, this is where the operating team comes in. We have the barrier there. So this is where the operating team comes inside the theater.